A lot can be said about pulmonary embolism, and I don't want to overwhelm you. Any patient with risk factors for PE who presents with shortness of breath and clear lungs should be considered to have PE until proven otherwise. Myocardial infarction, i.e. heart attack, can also present with shortness of breath and clear lungs. If it's a massive MI, you get pulmonary edema, which is manifested by crackles on physical exam. Pneumonias also have abnormal lungs exams and are usually unilateral. The big risk factors are surgery, pregnancy, and cancer. There are others, such as prolonged immobilization with truck drivers and thrombophilias, such as factor V Leiden. But the big ones to know are recent surgery, pregnancy, and cancer. Know the classical ABG, which is respiratory alkalosis with hypoxemia. The cause of hypoxemia in PE is VQ mismatch. This is not always present, but they love testing this. So the normal pH is 7.4. In respiratory alkalosis, there's no time for compensation, therefore the pH will be elevated. The bicarbonate will be normal, assuming that the patient had no other pre-existing condition, since the kidney did not have time to adjust to the metabolic alkalosis. The PCO normally is 40 and it would go down. If the PE is massive, it can lead to right ventricular failure, manifesting with jugular venous distension, loud S2, which is a specific sign of elevated pulmonary arterial pressures, and hypotension. Cardiac tamponade can also present with jugular venous distension and hypotension, but there's no hypoxia and there's no loud S2. It's also more gradual in onset if the patient has cancer or dialysis and not sudden. Sudden tamponade usually happens with stab wounds or after bypass. Initial diagnostic study of choice is a CT angiogram. Choices such as echocardiogram or lower extremity ultrasound are not appropriate. D-dimer is only acceptable if the probability is low. Once the diagnosis is confirmed, treatment is heparin. Warfarin is an incorrect choice in the initial treatment because it takes time to achieve therapeutic anticoagulation. Aspirin also is incorrect because aspirin is for platelet-rich clots, while the clot in PE is for fibrin. Thrombolytics, i.e. alteplase, is only indicated for massive pulmonary embolism. If you want to talk to a human about your step 2 struggles, please email me. I also have a free 500 question knowledge builder. These are questions to help reinforce knowledge concepts.